It's hard to imagine now, but until the advent of cable TV, folks in small towns didn't really get much in the way of outside news. They'd read the daily paper, listen to the radio, and if they were lucky, catch the occasional documentary or educational film at the local picture show. So when it came to matters of sex education, well, they were on their own. But this wasn't all that surprising given the social climate of the time. Till very recently, we as a society weren't exactly comfortable talking about STDs, contraception, or even the birds and the bees. This lack of knowledge had dire consequences. Today we're exploring how misinformation and stigma lead to bad choices. Keep watching to learn about an STD that was once called the social disease. Syphilis has been around a lot longer than our species. It first appeared in Europe in the 1400s and is named for the Greek word for falling sickness. Early symptoms include a fever, weakness, headache, but then a rash appears that can look like acne and then disappears. If left untreated, the bacteria can spread to organs, eventually causing paralysis, blindness, dementia, heart disease, or death. There's a cure, though, penicillin, and taken early enough, the damage done by syphilis can be reversed. But without treatment, its effects can be devastating. The first recorded outbreak occurred in Europe in the 1400s. Some scholars believe it arrived in the New World with Christopher Columbus and the conquistadors, while others think it may have been brought here intentionally to punish Native Americans for their perceived role in starting the French and Indian War. However, it arrived. By 1900, over 1 million cases were reported in the U.S. alone. With no cure at the time, the disease was often fatal. And because the symptoms were vague and nonspecific, many believed it was some kind of divine retribution for sexual immorality. To avoid the stigma and shame associated with the disease, many began referring to it as the Great Imitator or the Great Pretender. But a name change did little to change the deadly outcome. In the early 1900s, a small number of physicians began performing free clinics for the poor to treat them humanely and prevent further outbreaks. The first federal program, the Workmen's Circle Free Clinic, opened in 1911 and by 1916, 11 states, offered free or reduced-rate testing and treatment. During World War I, mandatory testing was introduced to keep the numbers down, and soldiers were punished for contracting the disease. Despite these efforts, syphilis continued to spread. Finally, in 1947, penicillin became widely available. And though many in the medical community considered this a victory, it also marked a shift in the nature of the disease. With easy access to antibiotics, people felt safer and began ignoring safe practices. Newspapers ran stories of penicillin-fueled nymphomania, supposed increase in casual sex brought on by the false belief that the cure had cured them. No longer the mysterious and terrifying social disease, syphilis was now seen as a mild inconvenience, something you could pick up and shake off in a couple of days. But this couldn't be further from the truth. The danger hadn't gone away, it had just changed form. Latent syphilis could remain dormant in the body for decades before symptoms reappeared. People thought they were being cautious by getting treated early, but the disease remained in their system and would eventually return. So you don't have to worry about contracting syphilis anymore, right? Well, yes and no. You're probably safe if you avoid high-risk behaviors like sharing needles or having multiple partners. But you can only get tested if you know you've been exposed or are showing symptoms. This means that most cases go undetected, and that's a problem because congenital syphilis is on the rise. Babies born to infected mothers can contract the disease and experience lifelong health problems or even die. In 2021, the CDC reported over 2,700 cases of congenital syphilis, the highest number since 1994. Knowledge is power. Not knowing about STDs or ignoring what we do know puts us all at risk. The best thing we can do is educate ourselves, be honest with our partners, and practice safe sex. If you want to learn more about sexually transmitted diseases, visit the website below, and thanks for watching. See you next time.